After studying these two modules, M1 and M2, you would be able to learn about the helping relationships, understand the challenges faced by the practice of counseling, examine the ethics, morals, and values in counseling, evaluate the future prospects of counseling. The helping relationship appears to be a cornerstone on which all effective helping rests. Words such as integral, necessary, and mandatory are used to describe this relationship and its importance in the ultimate effectiveness of the helping process. Even though different theoretical systems and approaches use different words to describe the helping relationship, each address the significance of the relationship in facilitating client change. The following are the definitive characteristics of the helping relationship. A relationship initially structured by the counselor or therapist but open to cooperative restructuring based on the needs of the client. A relationship that begins with the initial meeting and continues through termination. A relationship in which all the persons involved perceive the existence of trust, caring, concern, commitment, and act accordingly. A relationship in which the needs of the client are given priority over the needs of the counselor or the therapist. A relationship that provides the safety for self-exploration of all persons involved. A relationship that provides for the personal growth of all persons involved, and a relationship that promotes the potential of all persons involved. The major responsibility in creating this relationship rests initially with the counselor or therapist. Demands for client involvement and commitment increase over time. It is a shared process, and only through shared efforts will the relationship develop and flourish. Development evolves in stages that take the relationship from initiation to closure.
According to Burke and Stefflery, 1979, counseling denotes a professional relationship between a trained counselor and a client. This relationship is usually person to person, although it may sometimes involve more than two people. It is designed to help clients to understand and clarify their views of their life space, and to learn to reach their self-determined goals through meaningful, well-informed choices and through resolution of problems of an emotional or interpersonal nature. According to Feltham and Dryden, 1993, a principled relationship characterized by the application of one or more psychological theories and a recognized set of communication skills modified by experience, intuition, and other interpersonal factors to clients' intimate concerns, problems, or aspirations. Its predominant ethos is one of the facilitation rather than of advice, giving, or coercion. It may be of very brief or long duration, take place in an organizational or private practice setting, and may or may not overlap with practical, medical, and other matters of personal welfare. It is both a distinctive activity undertaken by people agreeing to occupy the roles of counselor and client, and an emerging profession. It is a service sought by people in distress or in some degree of confusion, who wish to discuss and resolve these in a relationship which is more disciplined and confidential than friendship, and perhaps less stigmatizing than helping relationships offered in traditional medical or psychiatric settings. According to British Association for Counselling, it can be seen from these definitions that counselling can have different meanings. For example, Burke and Stefflery stress that the idea of professional relationship and the importance of self-determined goals. The British Association for Counselling definition places emphasis on exploration and understanding rather than action. Feltham and Dryden highlight the area overlap between counseling and other forms of helping, such as nursing, social work, and even everyday friendship. However, these definitions share one important feature in common. They are framed from the point of view of the counselor. An everyday or user oriented definition of counseling emphasizes that counseling is an activity that takes place when someone whose trouble invites and allows another person to enter into a practical kind of relationship with them. A person seeks such a relationship when they encounter a problem in living that they have not been able to resolve through their everyday resources, and that has resulted in their exclusion from some aspect of full participation in social life. The person seeking counseling invites another person to provide him or her with time and space characterized by the presence of a number of features that are not readily available in everyday life, such as permission to speak, respect for difference, confidentiality, and affirmation. First, permission to speak. This is a place where the person can tell their story, where they are given every encouragement to give voice to aspects of their experiences that have previously been silenced in their own time and their own way, including the expression of feeling and emotion. Respect for difference. The counselor sets aside, as far as they are able to, their own position on the issues brought by the client and his or her needs in the moment, in order to focus as completely as possible on understanding, empathizing, and helping the client to articulate and act on his or her personal values and desires. Confidentiality. Whatever is discussed is confidential. The counselor undertakes to refrain from passing on what they've learned from the person to any other in the person's life world. Fourth, affirmation. The counselor enacts a relationship that is an expression of a set of core values: honesty, integrity, care, respect, and regard. That is, belief in the worth and value of the individual persons, genuineness, commitment to a dialogue and collaboration, reflexivity, the interdependence of persons, a sense of common good. Taken together, they represent an arena for support, reflection of the meanings or emotions, and renewal that is distinctive within modern societies. Within the arena, the client and the counselor make use of whatever cultural resources come to hand, such as conversations, ideas, theories, rituals, altered state of consciousness, problem solving algorithms, discourses, technologies, to achieve a satisfactory resolution of the initial problem in living that initiated the decision to engage in counseling. Five major goals of counseling are often stated as: first, facilitating behavior change; second, improving the client's ability to establish and maintain relationships; third, enhancing the client's effectiveness and ability to cope; fourth, promoting the decision making process; and fifth, facilitating clients' potential and development. Facilitating behavior change. Almost all theorists indicate that the goal of counseling is to bring about a change in behavior which will enable the client to live a more productive, satisfying life as the client defines it within society's limitation. Second, improving the client's ability to establish and maintain relationships. Much of one's life is spent in social interaction with other individuals, yet many clients have a major problem relating to other people. This may be the result of the client's poor self-image, causing him or her to act defensively in relationships, or it may be seen as the result of inadequate social skills. Counselors work with the clients to help them improve the quality of their relationships with others, enhancing the client's effectiveness and ability to cope. Blackham points out that children who have grown up in an excessively strict homes frequently adjust to training measures by developing certain forms of inhibited behavior. Such children may learn to be conforming and submissive. As long as the demands made on them by their social and occupational environment are compatible with these traits, they may adjust reasonably well. However, when the social and occupational responsibilities requires these individuals to behave more assertively, they begin to feel anxious, handle occupational responsibilities ineffectively, and exhibit physical and psychological symptoms such as frequent headaches, stuttering in the presence of people in authority, or inability to sleep, etc. Helping individuals learn to cope with the new situations and new demands is an important goal of counseling. Promoting the decision making process. An individual may have to decide, among other things, what careers to pursue, whether to accept a new job that has both advantages and disadvantages over the old job, or whether to marry, whether to dissolve a marriage, or whether to give up a valued professional goal for a job more suited to one's capabilities. Counseling helps individuals obtain information, clarify, and sort out personal characteristics and emotional concerns that may interfere with or be related to the decisions involved. It helps these individuals acquire an understanding not only of their abilities, interests, and opportunities, but also of the emotions and attitudes that can influence their choice and decisions. According to Reeves, the primary objective in counseling is that of stimulating the individual to evaluate, make, accept, and act upon his or her choice. In this way, individuals become independent and avoid a continuing dependency on a counselor. Counseling helps individuals obtain information, clarify, and sort out personal characteristics and emotional concerns that may interfere with or be related to the decisions involved. It helps these individuals acquire an understanding not only of their abilities, interests, and opportunities, but also of the emotions and attitudes that can influence their choice and decisions. According to Reeves, the primary objective in counseling is that of stimulating the individual to evaluate, make, accept, and act upon his or her choice. In this way, individuals become independent and avoid a continuing dependency on a counselor. Facilitating clients' potential and development. This goal can be viewed as one of improving personal effectiveness. Blocher suggests that A. Counseling seeks to maximize an individual's possible freedom within the limitations supplied by himself or herself and his or her environment. B. Counseling seeks to maximize the individual's effectiveness by giving him or her control over his or her environment and the responses within him or her that are evoked by the environment. According to Crumbols and Thoreson, counselors work to help people learn how to overcome excessive smoking, drinking, to take better care of their bodies, to overcome shyness, stress, and depression. They help people to learn how to overcome sexual dysfunction, drug addiction, compulsive gambling, overweight, fears, and anxieties. At the same time, counselors can help people with their interpersonal problems, with emotional problems, and with the development of learning and decision-making skills. Finally, whether or not a particular counseling experience will be worthwhile to the client will depend on the client's expectation. Many clients expect to have something done to or for them as a part of the counseling process. Counselors must communicate to the client that ultimately it is the client who acts, decides, changes, and becomes. In addition, clients often seek counseling in crisis situation, hoping to find remediation, whereas counselors operate with preventive or growth inducing goals. In these situations, counselors respond to the immediate need of the client, while working towards some intermediate or ultimate goals through the counseling process. Some of the different aims that are espoused either explicitly or implicitly by counselors are listed as follows. First, insight. The acquisition of an understanding of the origins and development of emotional difficulties, leading to an increased capacity to take rational control over feelings and action. Second, relating with others, becoming better able to form and maintain meaningful and satisfying relationships with other people, for example, within the family or workplace. Third, self awareness, becoming more aware of thoughts and feelings that had been blocked off or are denied, or developing a more accurate sense of how self is perceived by others. Fourth, self acceptance, the development of a positive attitude towards self, marked by an ability to acknowledge areas of experience that had been the subject of self criticism and rejection. Cognitive change, the modification or replacement of irrational beliefs or maladaptive thought patterns associated with self destructive behavior. Second, behavior change, the modification or replacement of maladaptive or self destructive patterns of behavior. Third, systemic change, introducing change into the way in that social systems operate. Fourth, empowerment, working on skills, awareness, and knowledge that will enable the client to take control of his or her own life. Fifth, reinstitution, helping the client to make amends for previous destructive behaviors. Sixth, generativity and social action, inspiring the person a desire and capacity to care for others and pass on knowledge, and to contribute to the collective good through political engagement and community work. The potential outcomes of counseling can be understood as following into three broad categories. First, resolution of the original problem in the living. Resolution can include achieving an understanding or perspective on the problem, arriving at a personal acceptance of the problem or dilemma, and taking action to change the situation in which the problem arose. Second, learning. Engagement with the counseling may enable the person to acquire new understandings, skills, and strategies that make them better able to handle similar problems in future. And third, social inclusion. Counseling stimulates the energy and capacity of the person as someone who can contribute to the well-being of others and for social good. Similarities and differences. Some practitioners consider the two as differing in terms of goals, client, settings, and training. First, differences in goals. Blocher in 1966 distinguished between counseling and psychotherapy by pointing out that the goals of counseling are ordinarily developmental, educative, preventive, and goals of psychotherapy are generally remediative, adjustive, therapeutic. A frequent goal of counseling is to help individuals deal with the developmental task appropriate to their age. For example, the adolescent who is being helped with problems of sexual definition, emotional independence from parents, career decision making and preparation, and the other tasks of typical of that age in our culture. While a middle-aged person grappling with these same problems might be the appropriate concern of a psychotherapist. According to McLean, 1955, the counselors would be concerned with preventive mental health, whereas psychotherapists would give primary emphasis to present deviations with secondary attention to prevention. Also, counseling has as goal long-range educational and vocational planning. The goals of psychotherapy are more likely to involve a quiet, complete change of basic character structure. The goals of counseling are apt to be more limited, more directed towards aiding growth, more concerned with the immediate situation, and more aimed at helping the individual function adequately in appropriate roles. Differences in clients and settings. The traditional view has been that the counselors deals with normal people and the psychotherapists deal with the neurotics or psychotic people. Hence, psychotherapists are more apt to work in hospital settings or in private clinical practice, whereas counselors are more appropriate to work in educational settings. However, as counselors become employed in a wider range of settings and more psychotherapeutics are employed in school systems and colleges, such a distinction becomes less meaningful. Blocher lists 5 basic assumptions about clients and counselors that he believes further differentiates counseling from psychotherapy. First, counseling clients are not considered to be mentally ill, but are viewed as being capable of choosing goals, making decisions, and generally assuming responsibilities for their own behavior and future development. Second, counseling is focused on the present and the future. Third, the client is not a patient. The counselor is not an authority figure, but is essentially a teacher and a partner of the client as they move towards mutually defined goals. Fourth, the counselor is not morally neutral or amoral, but has values, feelings, and standards of his or her own. Although the counselor does not necessarily impose these on the client, and at the same time, he or she does not attempt to hide them. And finally, the counselor focuses on changing behavior, not just creating insight. Differences in training. More objective observers distinguish between counseling and psychotherapy on the basis of the extent of training of the practitioners in personality theory, in research methods, and in the formal internship. Nevertheless, certain commonalities of method is widespread among the practitioners of counseling and psychotherapy. Burke and Staffelry have pointed out that counseling is characterized by shorter duration of treatment and less frequent visits by the client. Counselors make greater use of psychological examinations, are more concerned with the client's present daily problems, and place greater emphasis on the client's conscious activities. They give more advice, show less concerns with transference. Counseling is further characterized by more cognition and less emotional intensity and more clarity and less ambiguity.
Another factor that affects the helping relationship is cultural diversity. Awareness of cultural diversity involves the counselor's or therapist's openness and motivation to understand more about his or her own culture, as well as the cultural differences that clients bring to the helping relationship. Aniska and Newlon 2003, Montgomery and Kotler 2005, Siu and Siu 2002. Such understanding is often characterized as the cornerstone on which the helping relationship rests. This understanding, which is based on education and life experience, should enable counselors or therapists to increase their sensitivity to the issues that confront clients, should enable them to develop insight into the many variables that affect clients, and should enable them to place clients' issues, problems, and concerns in a proper perspective. The key word in these 3 statements is should. Experience indicates that the key factor in the development of cultural awareness is the individual's receptiveness, openness, and motivation to gain such awareness. Without these characteristics, both education and experience will have little value. The combination of these characteristics with both education and experience enhances the chance of changing to should and will.